Thank you so much, Christina, for that introduction. I'm really honored and happy to be joining you from the International Labour Organization here at our headquarters in Geneva. This is quite an interesting topic to be speaking about, especially as the world has faced an incredible pandemic that we have not seen in over 100 years. This has definitely affected the world of work in ways that we are not even able to describe fully as of yet. It's also affected the way we view our safety and health in our different working arrangements. So I think it's quite a timely topic to discuss what have been the emerging issues and risks that have affected our changing work life and our changing impact on our health and safety. A quick reminder of where we are and the International Labour Organization. So we are a United Nations agency, and we were actually founded and established before the United Nations in 1919. And it's the first and oldest specialized agency of the United Nations. What is different about the ILO is that we have a tripartite governance structure. Most UN agencies are governed by governments, and different governments represent their countries, and they have the ability to vote and ratify international standards or resolutions. At the ILO, we actually have worker representatives and employer representatives and governments, mostly ministries of labor, who make the various decisions about the world of work and the labor management around the world. So that's why we have this tripartite structure where everything is based on a debate and negotiation and social dialogue between our social partners and governments. The mission of the ILO has been to promote rights at work, and today social justice and rights at work takes on an even more important meaning, and our constitution and mandate has become quite present as the world faces precarious work and more uncertainty in what work looks like as we move into the future. Another strength of the ILO is the development of international labor standards, and these are legally binding conventions, and we have now over 190 legally binding conventions that range from issues of managing wages at work, gender equality, elimination of child labor, elimination of forced labor, working conditions, safety and health concerns, risk-specific safety and health concerns, sector-specific concerns. And so with over 190 internationally legally binding conventions, the ILO's main mandate has been to develop this normative framework for the world, where we advocate for governments to ratify these conventions. And once ratified, they actually then translate their provisions into national legislation. And this has been an important game changer globally, where we can ensure minimum standards are met in the world. Obviously, developed countries, can even exceed the standards and the provisions that we require. But the idea is that developed, and countries from different economic and demographic situations can actually abide by these values and principles globally. Most of these conventions are accompanied by recommendations, but the recommendations are not legally binding. They just provide more guidance and more explanation about the provisions of the conventions. And of course, we have different also protocols or different kinds of legislation that international legislation that we can actually adopt and implement in various countries. What's important for us is that occupational safety and health has been at the center of the ILO's priorities since 1919, since its inception. And some of our key global conventions on safety and health include the following that you see here. And Convention on Occupational Safety and Health, the most general one, is Convention 155, that really sets out the basic measures in the workplace that employers need to abide by and ensures what are their duties and responsibilities, but also their obligations towards workers and workers' obligation to collaborate with the employers in order to ensure safe and healthy working environments. And so that's one of our most basic conventions that sets out these founding rules. We have another very core convention, which is on health services, and we will see that this is, taken on a lot of importance through the pandemic as well. We also have an international, globally recognized list of what we call occupational diseases. A list of what we call occupational diseases is important not only to diagnose and recognize these as occupational in terms of exposure and impact, but also to ensure compensation for workers who actually have any of these diseases due to exposure in their workplaces. And then after a number of risk-specific conventions on chemical hazards, biological hazards, ergonomic hazards, and others, we also have these sector-specific hazards where it's about managing occupational safety and health in the agricultural sector, in construction, in mining, and in different sectors. We also have a promotional framework convention, which is our most recent, but not yet today. It's a little bit old, but still stands strong, is the Convention 187 that really sets out the way governments systematically manage occupational safety and health by developing a national policy on occupational safety and health, where there's a general national commitment and engagement to OSH being rated high on the agenda for action and for budgets, but also developing a program and a strategy that is time-bound, where the roles and responsibilities of the different actors and stakeholders is quite clear, and that actually has a budget set to it. And so it could be a program for over 5 years where we see, the most accidents and diseases are happening in the construction sector. So we would prioritize that. And that convention, which is the Promotional Framework Convention, really sets out this systematic approach. Another most recent convention adopted 2 years ago is the ILO Violence and Harassment Convention to eliminate violence and harassment in the world of work. And that was quite an innovative convention in that it covers all workers. They could be volunteer workers, they could be interns, they could be even applicants, where there's any form of discrimination on protected grounds or other, but also beyond that, where there's harassment that is not linked to discrimination in the world of work. And we've seen all kinds of psychological and emotional and mobbing and bullying happening as the world changes, as competitiveness around the world also increases, and as the identity and meaning of what work is changes. So this convention has come to fill that void globally, where there was no international convention, particularly for the world of work, to protect against violence and harassment at work. So I've chosen just a few of these conventions. And more importantly, today, the ILO is currently discussing the potential for occupational safety and health to be a fundamental principle and right at work. In its over 100 years of action, the ILO had identified only 4 key labor values and principles as fundamental rights at work. And they were historically and institutionally the right to the elimination of child labor, the right to non-discrimination and freedom of association, and the elimination of forced labor. But safety and health was never recognized as a fundamental right. And it has been now over 4 years of negotiations between employers, workers, and governments. And we are at the final stage, hopefully this June 2022, in our International Labour Conference. It will be adopted that the ILO recognizes safety and health as a fundamental principle right at work. And what that will mean is that every country around the world, whether they have ratified some of our key safety and health conventions or not, they are bound by the provisions and they are bound to implement them. This, of course, affects free trade agreements, whereas these conditions and principles need to be reflected. And so it will change what safety and health means around the world, especially in these times where uncertainty and precarious work is on the rise. So I think we're on the verge of big international changes that will affect the supply chains, global supply chains around the world in terms of protection and conditions of work that should be a minimum to be able to conduct work at a national level, at a regional level, and an international level. So this is a quick reminder of what we consider as non-standard forms of employment. And this terminology keeps evolving, of course, and different countries refer to these forms of employment differently. Currently, the ILO refers to them as non-standard forms of employment. And the common forms that you may have heard already yesterday and today obviously include the following forms. So it's important to just remember what we are talking about and why safety and health conditions across these various work arrangements could differ. So we're talking about seasonal work in agriculture when people only work the summer or work the autumn season, temporary employment, part-time or on-call work, employment when there's multi-party employment of certain workers, sometimes disguised employment where we're not clear, who's really employed, self-employed, and the whole of the informal economy. One of the problems we face as we do our work at the International Labour Organization and through the different projects we have around the world, in all corners of the world, is that over 90% of work is conducted through the informal economy with as few protections as you would expect. And that remains a challenge because from a normative setting organization where we're all about legislation, regulation, and enforcement and compliance, everything that we actually promote in our legislation does not reach or cover or protect the workers who are most vulnerable. And this is at the core of our discussion today. So why do we have these increased safety and health concerns? Obviously, these are people in these different precarious work, lack health insurance, life insurance, anything that would cover leave and sick pay or pension that is recognized. The hours that they work are often unpredictable, and so there is a risk in overtime, and the association between long working hours and increased safety and health risks and increased risk for accidents is also quite established. One thing we need to remember, obviously, is that globally there are over 3 million people dying yearly due to exposures at work, due to injuries and diseases from work. And this is quite an underestimation because there is a lack of reporting, notification, and reporting of accidents and diseases occupational, and there's a lack of diagnosis of these diseases as occupational. But still, it is an alarming number, and over 400 million people live with injuries and diseases. So it's not just about the fatalities, but it's about how many people also are living with a poor quality of life due to exposures at work. Of course, any type of training or competence in safety and health seems to be very poor when we're talking about precarious work. There's a lot of cases of unfair dismissal, and that really discourages workers from speaking up and voicing their concerns. One of our basic rights in Convention 1555 is really the right of removal. It's the right of workers to remove themselves from situations that they consider are hazardous, and the right to remove themselves without retaliation. And this is often, there's a breach and violation of this provision across the world where people do not feel that they can do that without being, unfairly dismissed. And what the pandemic has shown is that more and more people went to work and they were scared for their health, scared for their families, but they were forced to go to work, otherwise they'd lose their jobs. And that is at the heart of these provisions that we would try to implement to protect workers. Violence and harassment, obviously, the people in precarious work face more and more issues related to discrimination, but also broader issues of violence and harassment for all the various reasons we listed before. We also find a lack of meaningful and productive work, because it's one thing to go to work just to earn a living. It's another to feel that you fulfill and achieve something important and relevant and meaningful that actually adds up to something that makes a difference in life. And so having a job that does that is really important. And it's often not there when we're talking about precarious work. And this leads to insecurities and psychosocial distress, which in turn leads to physical impact and physical negative impact on your health. There's even more breaches of privacy and data use for those in digital growth platform and the gig economy, which we will be discussing throughout these days. So these are just some of the key issues, obviously, that affect the safety and health of workers when they're in these forms of non-standard employment. And along came COVID-19, obviously, to only exacerbate the situation where people were even more scared to be infected with the virus, but continued to go to work. The healthcare sector was hit very hard, but also a lot of the essential workers that continued to work in different forms to deliver different services um, during the pandemic. A lot of people that really needed personal protective equipment did not have access to it and were forced to continue to work and deliver their different tasks without that minimum protection. They did not have any training and let alone any resources to actually have what they need to deliver their jobs. We saw a rise in psychosocial risks and exposure to different psychosocial risks at work. Again, because these are people that have no access to social security and social protection, and even their jobs are on the line. So they were not sure whether today they're going to be fired or tomorrow. It was quite precarious, the way that jobs were seen and the need for jobs and certain jobs just became somehow, irrelevant throughout the pandemic. And there was no clarity inside as to whether life will come back to normal and when that was. And we see many sectors were hit hard, like the hotel industry and the food industry and many other industries that were really hit hard by the pandemic. Micro, small, medium enterprises are also another interesting body of research there, because it really overlaps with precarious work that's mostly found in these micro enterprises that seem to go hidden under the radar, and they face a lot of safety and health challenges already, even without the pandemic, but also even if some of the work there is regularized. They do often operate in the informal economy. They lack any people who are competent in the area of safety and health to deliver. Speaking to so many different stakeholders and actors in the construction sector, in small and even larger enterprises, everybody seems to be, in agreement that it's important to care for safety and health. It's important to prevent accidents and diseases at work. But there seems to be a lack of knowledge, and there seems to be a lack of investment of someone who's on site to actually follow up, because this is not a one-off action. So you don't come in and say, okay, this is the personal protective that we need to wear. Here are some administrative measures that we need to make, and your safety and health concerns are solved. This is by continual improvement, continual risk assessment, action that needs to continually be taken. And the cycle continues. So you need presence, you need follow-up, otherwise everything is meaningless. Because we do hear, some employers tell me, oh, we gave our workers personal protective equipment, but they didn't wear them, or they found them uncomfortable, or they actually sold them to make money. But the idea of providing, well, first of all, it has to be your last option to provide personal protective equipment. We need to be taking all forms of elimination, substitution, administrative controls before we actually provide personal protective equipment, unless it's in the healthcare sector, of course, and unless we're dealing with a pandemic, then, it becomes higher up on the hierarchy of controls. But the idea of providing personal protective equipment, for instance, is to provide the training needed, the reason workers need to understand in a language they understand why these are important, how they protect their lives and their health, and they need to continuously be, listened to. So if there are problems, we need to take them into account, adapt and change if something's not working. So it's not something we give and we walk away. It's something that needs continuous incentives, rewards, training. It's a conversation to be had, etc., to create that culture of safety and health that we want to create in the long term. And so looking closer at micro, small, medium enterprises, there's a lot of overlap. in the different risks that we face concerning safety and health with precarious work because of this limited access to information and training and this perceived cost that, to have a good system in safety and health, it costs too much money. That's not necessarily right. There are a lot of housekeeping measures sometimes that could be done in terms of storage, labeling, and others that could really save lives and prevent meaningless accidents that happen on a daily basis on work sites. So here I would like to just discuss very quickly the actual strategic areas that we can aim at to improve occupational safety and health in non-standard employment. So again, we come back to the regulatory frameworks. While that is not the ultimate goal or answer, but we do have to work there. And we've seen in some countries where there's a particular budget, resources, and regulation that really gives the mandate to focus and develop a targeted strategy for precarious work, non-employment, or small, medium enterprises with a certain budget, with a decision of who's responsible for this, that actually does make a change. And it remains an important vehicle to provide that minimum standard, even through regulation for these forms of precarious work. The labor inspection, which is quite traditional, but also all forms of compliance, continue to be very important forms where we can have access to information, play an advisory role in some of these precarious work, and establish priority interventions. And that's how we can register what's going on and actually start zone by zone developing some solutions and interventions to adapt it to the actual needs on the ground. The use of sanctions, obviously, to motivate employers also works. So it really depends on the sector, the scope, the regions covered, and the level of the country and socioeconomic context. But sanctions are still important, and they do serve to inhibit further violations when there's a level of abuse that there is in terms of precarious work. Economic incentives and rewards have also been shown to make the action that we take more sustainable. They can be, for example, tax reliefs, reductions in insurance contributions of these companies, or other forms of negative payments. An occupational safety and health management system is crucial. And so we know that it works well in bigger enterprises, but it can be adapted to small enterprises because it really depends on the activity and on the nature and the size of the enterprise that you can actually adapt the needs to establish a good occupational safety and health management system. And the ILO has an occupational safety and health management system 2001 guidelines that we promote globally, that sets out the need to the participation and consultation with workers and their representatives from the onset, from setting that workplace level policy or national policy, but also from the implementation of action and risk assessments and investigation of accidents, reporting and recording, and sharing of information and training that is normally provided during working hours at no cost to the workers, and personal protective equipment that is provided with training at no cost to the workers. So these are basic principles that we would like to promote from some of these ILO guidance and provisions. Safety and health should also be included in national programs on capacity building, targeting non-standard forms of employment. Other strategic areas, of course, include continuous monitoring and evaluation. Again, safety and health is not something, that an intervention that we come in and we leave and then our job is done. It requires continuous attention, monitoring what has worked, what hasn't worked, the impact, the decrease or increase in accidents or diseases, and the different indicators we need to be measuring throughout the process and through the outcome phase as well. Having an appropriate means of communication. So sometimes outreach is a problem when we're talking about precarious work, because you can't reach these workers. They're either seasonal, temporary, part-time, So a general attack through mass media, general awareness, through families, through communities, through faith-based organizations, municipalities, and other is really important to make sure that people slowly start valuing their health and take less risks, and their behaviors evolve as they start to appreciate the need to protect their safety, health, and just because we have jobs, it doesn't mean we need to lose our health to have a salary or income at the end of the day. Sometimes sharing good practices can be motivating and inspiring, and particularly if these are systematized and the institution actually makes these practices accessible. So different authorities, depending on the country, play an active role in promoting these good practices and sharing, that it could be quite easy to find solutions in certain sectors, and we have a lot to learn from each other. And some of this actually, they're quite developed in the private sector, and so having that support throughout the global supply chain, and the support from private companies to public, and having these partnerships between private-public partnerships is really important, and understanding the point that this is an investment in economic growth, an investment in businesses and productivity, an investment in your main asset, who is your worker. Another key aspect we found is the importance of intermediaries. These could be loan officers in different companies and enterprises, and it could be a win-win situation where you help some companies where there's a lot of precarious work improve their safety and health, then they retain their workers, there's less turnover, and then there's more productivity and the work is successful, and then the loans are being paid back. And so there's this rush to actually train these intermediaries in whatever form or networks that they belong to actually have them play that role to promote safety and health, and to promote certain solutions. And that can be done through participatory approaches, of course, at workplaces, and it could be very basic to something more sophisticated. So there are quite a lot of examples. We've produced a number of publications of the ILO from around the world, from different regions in Asia, in Africa, in Latin America, in Arab states, where you could really consult some effective strategies and ways that governments, along with workers and employers, have been able to offer solutions to improve safety and health in non-standard forms of employment, and in all forms of work that would be seen as less protected, and has access to less resources, of course. So this was just touching a little bit upon some of these issues that safety and health concerns, safety and health among us. And obviously there's a lot more to talk about this issue, but happy to take some questions at this stage. Thank you.
Thank you so much, Manal. What a highly informative presentation. Really appreciate all the attention you paid to the large range of issues and potential strategic areas of improvement, which we all hope will improve the condition of occupational safety and health. I would like to start with some general questions, if you don't mind, which I think might emphasize some of the points you've already made, but also elaborate on them. So we'll take a little bit of a view of the past by asking, pre-pandemic, what did you think were the most important working conditions to address before we experienced COVID? Do you mind elaborating on that just a little bit?
Thank you, Christina. Yes, of course. Sometimes it feels like it was decades ago, the life before the pandemic. But obviously there were many changes already, and we were, if we look at the risk observatory globally, the world was changing. So we sort of had this fast track with the pandemic. where work arrangements, changed. We have this huge increase in telework, for example, but we were already moving in this direction, just a little bit slower and with time to prepare. And so the various risks we were seeing are particularly risks on psychosocial risks, mental health concerns, as there was an increase in competition globally in different sectors and in different regions where people, there was no cost and that was too high. And people were just suffering in terms of absenteeism, presenteeism at work, where they were trying to make ends meet, struggling between work life and home life. And that just was exacerbated by everyone being pushed away from certain workspaces that were classically known as workspaces to having to have their homes as their workspaces, which brought on new risks. So the risks that were emerging were partly that, but obviously we continue to have a lot of increase in chemical risks. So that was an area that was taking a lot of interest, and hence the discussion on climate change, but also on green jobs and the environmental concerns with the overproduction of chemicals globally. Biological hazards wasn't as important as it is now, after the pandemic, but it was already there as a major issue in certain sectors, but not in all sectors. And the physical risks, the classical falls and slips, continue to be concerns, especially in construction and in manufacturing. But some of the leading causes were really long working hours and association with cardiovascular risks and a lot of occupational diseases from exposure to hazardous substances. So before the pandemic, we were, moving away from safety concerns already, but into health concerns due to changes in work arrangements, but also to overproduction and overexposure to hazardous substances.
So that's interesting that many of the things that were concerns before have continued through the pandemic, but we are seeing some new things emerging as critical. And you pointed out that we have concerns about physical health and emotional health. And I'm wondering whether through the interventions that you have studied and implemented yourself, which of the two, mental health and physical health, have been more successful in addressing? Is it easier for entities to address mental health, or is it easier to address physical health?
Of course, so that's an important question. My immediate answer would be it could be much more straightforward to address physical health. The problem is the blurred line for mental health, where it's easy for an employer to say that's not my problem, that's something that's related to something outside of work. And that's why it's important to look at the human being as a whole, and to look at our work life as a whole, because we change jobs. There's a whole spectrum as we move from career to career, as we also, that's changed a lot. In the old days we'd have one career and stick to one job mostly, and now people are more creative, they're more curious, they want to be moving to better opportunities. And so their different impacts that they live on their health are not necessarily due to one level of exposure or to one job, but definitely mental health. And we're currently actually developing global guidelines with the WHO on mental health at work. And it's actually been difficult to even find a title, because we want to say mental health, but we don't want to say at work. We want to say and work, because work is everywhere. It's all around us, before and after, during. Is it the place, but is it, the working from home? It's about connectivity, it's disconnectivity, and all of those questions. And so when you look at mental health and work, it is more complex. And if you want to do a risk assessment on mental health, it is, you're going to be looking at critical events, you're going to be looking at predispositions, and not just at face value things that you can see with the naked eye that are actually of concern. And when you look at solutions, they're related to everything from gender equality to promotion opportunities, especially when you're talking about the world of work. So we are looking at work being a sense of identity. So that having a job is already something that affects our mental health. We are looking at people who already have a mental disorder, illness, or disability, and they come into the job, and that can be worsened or improved or supported. We are looking at people who come into jobs and are completely healthy, and due to psychosocial risks at work, develop mental health illness. And then we're looking at what you're going to do about them when they do develop them. Is there a reporting system? Is there a support system, social support system, psychological support system? Is there enough accommodation opportunities for people to be accommodated from one task to the other, adapted to their certain needs? And is there, all kinds of protections from dismissal when people develop? So it is such a spectrum that it is much more complicated, but we could focus on organizational behavior and organizational health and what we can actually control in terms of human resource management and psychological and organizational management that could prevent at least the psychosocial aspect that we can control as employers, because it's not an individual problem. It's a problem with the way we organize work, the interpersonal skills, on who we appoint as managers, on how we have a career growth opportunity or not for people. So the questions are complex, obviously, and it is quite multidisciplinary in the way we need to address mental health as opposed to physical health.
It certainly is daunting to try to really move the needle on occupational safety and health when you include both mental health and physical health in our approach to creating healthy workplaces and healthy conditions of work. During the pandemic, we had essential workers and non-essential workers here in the US, where essential workers had to push through terrible working conditions with respect to just becoming sick. And before we had vaccines, running a risk of very serious illness and death. And after the vaccine, that continuing concern, it's not as if the vaccine solved all of their concerns, but we certainly had a lot of problems with people being concerned about continuing to come back to work. And then with remote workers, non-essential workers working at a remote location or in their homes, we've got a lot of issues with their wanting to come back to work. So given the pandemic and what you have seen about the shift to health, more so during the pandemic, projecting out into the future, what do you see as the most important aspects to focus on when we have all of this to be thinking about in terms of mental and physical health and different conditions of work where they might be on site, they may be home, they may be out in the field, they might be in vehicles and so on, because your agenda is so complex and so important and comprehensive. Can you give any guidance for the future in terms of where we ought to focus and where we think there might be the greatest opportunity for significant improvement?
Yes, sure. That's a really important question too. I think there are two aspects here. So there's an aspect of emergency preparedness, of crisis management. And the idea is to be able to prepare, anticipate for a crisis rather than actually try to manage it and prepare your emergency system when you're in the middle of a crisis. That's one aspect. Second is to actually make sure that occupational safety and health concerns, when you're managing a crisis at a national level, are integrated in your national crisis management plan. And so that not every sector or issue has their own crisis management. And we realize the importance between occupational health and public health speaking to each other, especially when we're talking about infectious disease. And so we realized that occupational health services played an extremely important role in the way they were able to mitigate the spread of the virus at the workplace level in certain sectors that affected positively or negatively the communities around them, and the other way around. So the key takeaways are: invest in your occupational health services. It's not just for crisis, it's for managing safety and health of workers. You're managing workers that then have families, that live in communities. There are no more lines between, workspaces and life. And so the occupational health management and services need to be talking to the public health management and services. While they operate differently, and even at the level of governments, to get the Ministry of Health to speak to the Ministry of Labor or Ministry of Agriculture to the Ministry of Industry, it's not straightforward. And so while at our level at UN agencies, where even, we have a division of labor as well, for different agencies to speak to each other, it's already complicated. And then we see that the same complexity at the national level for ministries to actually collaborate and divide their budgets in a proportionate way to the risk that the country is facing. So that has been really important: investing in occupational health services, planning, preparing, anticipating for emergencies before they actually happen, and integrating occupational health with other planning systems as well, having the right competencies available beforehand, and being ready and respecting the role of occupational health. And we see that now, like many companies and workers and across the supply chain have taken up a different interest. There's a huge momentum globally, we find, for health support in the world of work, and especially as we get calls from human resources. People are absent. People are present but not working. We've lost our main asset. We've lost our worker. So they're like, oh, we need to do something. So it is sort of reactive. Unfortunately, we would have wanted to be a bit more proactive, but this is what we have, and we need to build on the momentum we have today. And I think that's why it's really crucial that the ILO, along with its over 180 member states today, with the governments, employer organizations representing the world, are coming together this June to announce occupational safety and health as a fundamental principle right at work, which will be a game changer globally, where governments need to now abide by minimum standards in this respect and report to the ILO on a yearly basis, regardless whether they have ratified, adopted, translated our conventions into their national legislation or not. And that is huge. It will impact labor markets globally. And I think this is the time to move in that direction.
That's an excellent summary of where we need to go. Thank you so much for a terrific presentation. And I hope a year from now, we will have moved the needle with many of the things that you have suggested. Thank you again.
Thank you. Thank you so much.